everyone. This is Julianna LeMieux, Deputy Editor-in-Chief at Gen, and I'm coming to you from the AACR meeting in sunny San Diego. And I'm joined by my colleague, Damian Doherty, Editor-in-Chief at Inside Precision Medicine. Damian, thanks so much for joining me.
You're very welcome. Good to see you.
Yeah, how's the meeting been?
Meeting's been great.
Yeah.
Lovely to be back in sunny San Diego.
Yeah.
Yeah, can't believe it's been a year. Incredible.
Yeah.
But yeah,
Since Chicago last year.
Really excited to be here.
Yeah. It always feels, I always like coming to ACR. It feels like such an honor and privilege to really cover cancer research and all that's going on in this space.
Oh, without a doubt. And I think
Yeah.
they've built such an amazing community at ACR. And the length and breadth of the topics they cover is astonishing.
I know.
So I'm always amazed at how much there is to cover.
And how many people are here, how big the community is.
Yeah,
Yeah,
exactly.
it's shocking.
Very humbling.
Yeah. So we both got here on Saturday, and it was the reason to get here on Saturday really was because that was the night of the big launch of the 10x genomics news.
Correct.
And
yes.
it's been highly anticipated news in the genomics community. They've been teasing it for a while. And on Saturday night, we learned that their new instrument, a new spatial instrument, the Atera, they're taking orders now, will be available later this year. And, for 10x genomics, it's a huge advance. It's higher throughput, higher plex, higher resolution. So a big advance over any of their previous spatial platforms, really. And launched only, 3 to 4 years after the Xenium, which was their, the last launch. And so, yeah, it'll be interesting to see what happens. The spatial field is so competitive at the moment.
Sure.
The race continues on. But one thing that they presented was, I think for 10x, this is really a new beginning. This is now the platform to build everything on. And so they had a roadmap with, proteomics and automation and, data advances, and a de novo sequencing method that they just they didn't give a lot of details about. But so I think a lot more to come in the Atera space. So we'll see how it goes.
Right.
Yeah.
You've written a story on that.
Yeah, I wrote a story, and also I should say in the advances, it's whole transcriptome.
Yeah.
Which of course other platforms do whole transcriptome too, but new for 10x.
Right.
So yeah, as always, keep us busy watching that one. Yeah, exactly.
Good.
And speaking of nighttime activities, last night I went to the AACR reception and saw the checkpoints. Have you ever seen them play?
It's funny. They've been together, I think, for 19 years, but I've yet to see them play.
Next year.
But they're meant to be very good.
They're very good.
Yeah. And talking about checkpoints, I saw that Jim Allison had been honored this year and awarded the AACR Lifetime Achievement Award, which was great to see. So he flew in and flew out for that. So very, very well deserved. And actually, Dennis Lowe from the University of Hong Kong was honored as well this year, which is, again, very well deserved for the work that he's done in shaping NIPT, and of course the seminal work he did with fetal DNA in maternal plasma. So has really shaped a lot of what we see now in circulating tumor DNA. And strangely enough, he just a funny little anecdote. He actually had his light bulb moment. The discovery of how he could extract that DNA was when he was basically cooking noodles when he was in the UK. He looked at how he was trying to extract flavor from these noodles and realized he could boil the plasma, and that's what he did. So talk about strange moments in science where you can be cooking noodles and think, maybe there's something in this. So anyway, I never knew that story. It was a fascinating little story.
Yeah.
But there you go. So so what else have I seen? Popped into a session on ADCs. Antibody drug conjugates. Obviously, that's a therapeutic class that we talk about a lot in IPM, and I'm sure you do in Gen.
Oh yeah, lots of coverage in Gen.
Field that is progressing very, very well. It seems to be every year there's slightly better finely tuned mechanisms of action. Seems to be some great applications across all sorts of cancers, so pan cancer, ovarian cancers and uterine cancers. So there's some great data coming out of Dana-Farber for that, and some Chinese pharmaceutical companies. So definitely more to come on that. But I think that field is really starting to mature. and took into a workshop this morning actually from a company called Alamar
Hmm.
Biosciences. They
Hmm.
are a precision proteomics play, and they've been doing some work with MD Anderson, who have been doing some fascinating work on trying to create a personal vaccines, a universal personal vaccine. They really want to create something that's off the shelf. Problem with personal vaccines, as you know, is that they're quite tricky to make, and they take time to make. It's the time factor, 6 to 8
Right.
weeks. So it seems to be something that's used in the adjuvant setting. So if we could try and create something that's off the shelf, that's immediate. So they're doing some great work on that, and there's been some fantastic discoveries around mRNA vaccines and the COVID vaccine, sorry, and the implications there in fine-tuning or stimulating the immune response. They found that patients with cancer that had the mRNA vaccine were getting much better immune responses to immunotherapy, because we still have that problem.
Yeah, that's
There's
amazing.
at least 30-40% of people don't respond to immunotherapy.
Yeah, yeah.
So
Yeah.
that's some great work going on there at MD Anderson. So I sat and listened to that. So
Yeah.
that was enlightening.
Yeah, with new technology. I mean, Alamar is a
Yeah.
pretty new company,
Yeah,
maybe,
absolutely.
4 or 5 years.
Yeah.
They had an IPO. They rang the bell on Wall Street.
Oh, yes.
Yeah,
Yeah,
I
that's
think
right.
very, very recently.
Yeah, I think you're right.
Yeah.
Yeah, absolutely. So yeah, I think the feeling with Alamar is that they've got something that they can really take to the clinic.
Hmm.
The sense I got was that, there's a lot of these proteomics companies that are doing great discovery work, but has anyone really done that last mile? So they really feel they've got something that's very, very clinically important. So as I said, much smaller panels.
Well, and that's definitely a theme here is like, watching the technology move into applications and then move into the clinic.
Yeah.
I mean, that is like something we're seeing. I mean, not just in omics, which
Mm.
Alamar does fall into, but like, all the different spaces, just like
Yeah.
moving into the clinic, helping patients.
Yes.
That's what
Yeah,
it's all
yeah,
about.
yeah.
Well, speaking of that, actually, this morning I went to the Quanterix booth where,
Yeah.
sometimes they have like talks in the booth.
Mm.
So I was at the talk in their booth. And if you remember, they acquired Akoya last year, spatial technology. But, I think since then, like I haven't heard much about what the
Mm.
plan is. So they had the roadmap. This is Quanterix's first time at AACR.
Is it really?
So really showing, and their big message, which is why I'm bringing it up, is moving into the clinic.
Mhm.
And so I think, being here with their roadmap, talking about, combining the technology from Akoya that came from Akoya with Quanterix's infrastructure, is really now their plan
Right.
to make that move. So that was really interesting, and another spatial space to watch, I guess.
Yeah, absolutely. Well, talking about spatial, another kind of spatial is geospatial. And I was in a session that was talking about ostensibly social determinants of health. And we've known for a long time that your zip code determines, in many cases, your propensity for disease. But there are some very fascinating new technologies that are being employed to really look at the urban environment, or any environment for that matter, and make correlations between certain subsets of the population in terms of socioeconomic status, in terms of income, in terms of ethnicity. This all wraps around the whole disparities of healthcare. But some of these new technologies will be able to go in at a very granular level now, at street level, if you will, with obviously technologies from Google and others that can really create a snapshot of a picture around any environment anyone's living in, and say, okay, we can now start to make inferences about your environment and what that means for potential disease. And we can link that information from cancer registries, start to make really concrete sort of an analysis of where certain areas of disease are happening and why. And I think that's going to be really important research to be able to mitigate that in the future.
Well, and I think that that's one thing that I'm struck by every time I come to ACR, which is that they just cover it all across the board, cancer. And it's not just, everything from clinical trials to translational research to R&D to what the technologies are to even environmental influences and things, and patient advocates and patient, all of that. So, and there's clinicians here, physicians here. I mean, they do not leave a stone unturned.
Correct. They don't. Yeah, it's very comprehensive.
And yeah, so yeah, and actually on top of that, talking about covering everything and funding too, which they've had a emphasis on as well.
Yeah.
And
there's a decline in NIH policies for funding opportunities. I think we call them NOFOs is the acronym. So if there's a decline in those applications, if the researchers don't even know which grants to apply for, we're in a very, very bad situation. But I think there is still a sense of disenfranchisement. There's a sense of bewilderment. Some researchers are feeling, should I continue my career in science? And I think that the clarion call is to say, look, if it isn't the NIH, then look elsewhere for your grant, but don't give up ultimately. But yeah, funding is, still an issue.
I mean, the important thing is that they're talking about it here. There's sessions on it. They had NCI director here talking about funding. So, I mean, they're addressing it head on. And AACR also does a lot of advocacy around all the spaces. So, good for them for doing all of that. And always a pleasure to be here.
Always a pleasure.
So we still have a couple more days actually at the meeting, so more to come. It's
totally
been a busy time, but it's I just try to soak up as much as I can while I'm here,
Look forward to a couple of days and great discussions and
both IPM and Jen will be covering cancer, of course, until the next meeting. So
well, indeed, forever.
All right.
Yeah. Well, it's great seeing you.
Yeah.
Thanks,
Okay.
Julianna.
All right. Thanks all for listening.